It's an answer many parents waited months for. Today, the Washington State Board of Health said no, your kids will not be required to get vaccinated against COVID to go to school. Thanks for joining us. I'm Aaron Luna. Nia Wong has the night off. It took months for health experts to figure out if the vaccine should be required. Before we got to how they ended with this decision, we'll first look at how many kids are vaccinated in Washington. That number does continue to grow. As of last week, 62% of 16 and 17-year-olds are fully vaccinated. 54% of 12 to 15-year-olds are fully vaccinated, and 31% of kids 5 to 11 have both shots. In our vaccine information headquarters, Eleni Dow explains why the board made this decision and how local parents are feeling about it.
The decision to not require the COVID vaccine took months of research and consideration. The Washington State Board of Health commissioned an advisory group to look at 9 different criteria to see if it'd be appropriate to require the vaccine. Ultimately, they said no, and the Board of Health unanimously agreed with their decision. As parents, many decisions need to be made for kids. Spokane mom Carrie Hayes believes that should be the case for the COVID vaccine as well.
I believe in my heart that it is parents' choices and it should not be something that's required in school.
Mom Kimmy Clifton, on the other hand, while she chose for her kids to be vaccinated, she still thinks the COVID vaccine should be required for kids to go to school.
I feel like it's just like any other vaccine where it's a requirement and then you get to go.
Students are required to have the chickenpox, polio, mumps, measles, and rubella shots to go to school. Medical, religious, and personal exemptions can be requested, except for the MMR vaccine. The state does not allow personal exemptions. The COVID vaccine would have had exemptions too, but now the board decided against making it required for kids to go to school. The group looking at the requirements believe the COVID vaccine is effective and safe, but the shot did not meet other criteria, like the people's acceptance of the vaccine. They also wanted more data.
So this is, again, an issue that is very challenging, and as has been said before, we will continue to advocate for vaccines because we know they're effective, but we also have to look at the social implications thereof.
While moms like Hayes are happy with the decision, Clifton doesn't agree.
If they find that the decision is causing problems with outbreaks in the future, then maybe they'll revisit it. Otherwise, we're just going to have to trust that they know what they're doing and go with it.
Although the board decided not to require the vaccine today, it could look like the requirement would be talked about again in the future. The board says it's possible they'll discuss it again if another variant comes up or when the shot is fully approved by the FDA. In studio, Eleni Dow, 4 News Now.